So, what I am calling on journalists to do is that it is their responsibility, they being a group, but as it is also the responsibility of others, to push back on this misinformation by providing reliable information on vaccines, as both the vaccines and information on them become available. In other words, there will be a lot of information that are available on vaccines, either from the manufacturers or from scientists who have looked for these vaccines and found them, or from the authorities who will later on be regulating these vaccines, or who give permission or permits for these vaccines to be available in the market. Such information should be taken by journalists and provided to the public in a manner that they can understand. It is the responsibility, I believe, of everyone, but specifically journalists, to explain to their readership the need for vaccination as a means of controlling disease. But here, where we have this emergency covering the whole world, this information ought to be disseminated, and journalists are best placed to do so. By doing this, I believe we'll increase the likelihood of the vaccine uptake in Africa to about 70. Actually, what we should hope for is that more than 70% of the population will be vaccinated. I say 70% because this is the percentage you want to cover to gain reasonable protection of the population against the vaccine. If you have less than 70, or if you say you vaccinate only about 50%, then you may not be able to obtain the control that you're hoping to get. So who should be involved in this kind of work that I'm suggesting? I think everyone who is concerned about the welfare of Africans should. And I've talked about the importance of journalists, specifically science writers, science editors, health writers, and health advisors. And these are the people who will be talking to policy formulators and policy implementers. I believe many of you would know who is reading your writings, whether you write in dailies, whether you write in semi-specialized newspapers or journals. So you have a very good idea of who your readership is. And so you can target them with the information that you have digested and written in a manner that they can read and understand. Professionals with required information on vaccines, on vaccination, and the disease control should also join this work. Obviously, community leaders, because they are the people who are very much on the ground, and faith leaders should be involved. I must say here that a very significant proportion of the misinformation is coming from church leaders, unfortunately, either because of their faith or because in one way or another they oppose the use of vaccines. But that is the truth, that a lot of misinformation comes from people that are in the group that can be classified as faith leaders. So the information required should be objective and balanced. It should be based on science underpinning the vaccines, and it should be appropriate and relevant for the readership, but it should not be selective. In other words, one should not select and present only the positive or only the good parts of the information that's required, but nonetheless but should rather present it in totality, have it in a language that's understandable, and should be appropriate, and obviously respectful. It shouldn't be presented in a patronizing manner. And I think this can best be done by people who can be trusted by the readership. There's often presentation of the information by other people with whom the readership cannot identify. And I doubt if those pieces of information can be very useful if the reader or the hearer does not trust the person who is giving the information.